Hi everybody, and welcome to the first webinar with Diploma MSc and the foundation course. I'm Professor Steve Davies and I'm a consultant endocrinologist in the University of Wales, and I'm the founder of the foundation course and Diploma MSc program. And in our first webinar, I'd like to introduce you to lifestyle interventions in the prevention and treatment of type 2 diabetes. I think very little really little credence is given to this. So I want to go through the evidence with you. And what I'd like to do, if you review the PowerPoint slides, you'll see that what the key essence of this talk is about is I want to look at strategies, lifestyle strategies, that and what the evidence is in terms of preventing diabetes happening, because as we know, diabetes is a big problem. And then I want to look at lifestyle interventions in terms of patients who already have diabetes. So those are the two fundamental questions that I want to cover today. So the talk's going to be for about 10 minutes, and then at the end we've already been sent in some questions from candidates from other centres, and I'd like to talk about those questions. And if you do have any questions, please feel free to send those in on the live feed, and I'll do my best to try and address those in the next 20 minutes. So let's proceed with the PowerPoint to give you a little bit of a refresher in terms of background. And as you all know, 90% of patients with type 2 diabetes are obese or overweight. That contrasts with about 60% of the UK population being obese or overweight. And in consequence, it's resulted in a global epidemic in diabetes. So the obesity epidemic converts itself into an epidemic of type 2 diabetes. Looking at the UK alone, 2.6 million people out of a population of 60 million are diagnosed with diabetes, giving us about 6% of the population being diagnosed with diabetes now. Now, that really contrasts with the studies that we did, where we looked at the population back in the 1990s. About 1992, we started looking at this, 1992 to 1995. We found that 2% of the population had diabetes at that stage. And the studies, which are international, reveal that diabetes is not just a metabolic disorder of glycemic control. It translates into increased cardiovascular mortality. And the cardiovascular mortality is about 2 to 4-fold. Now, the studies that we produced back in 1997 revealed that of that 2% of the population, they were consuming vastly more health costs than just the 2%. In fact, our one study performed by Professor Craig Curry, who's a good friend of mine, and you probably are aware of him from many of the articles he's recently published on insulin translating into increased cardiovascular mortality and increased cancer risk. He demonstrated that that 2% were consuming 10%. So there's a 5 times the amount of healthcare costs attributed to diabetes in comparison to the 2% of the population. So now we're dealing with 6%, and that may translate into 30% of healthcare costs. So not only are we facing a global epidemic, but that epidemic is increasing mortality, but it's also consuming huge costs. So what can we do to tackle it? If we look at the next slide, the prevention studies, those are the things that I want to talk about at the moment, and there are 2 key studies that I really want us to focus upon. And that's the Finnish Dps Study, which was published in the New England Journal in 2001. It was a Finnish study where they looked at 500 patients with impaired glucose tolerance, and they randomized the patients, really good study, into intensive dietary intervention versus ordinary control, that which we usually do in our practice. And they had 5 interventions. 4 of them were dietary, and the other one was exercise, which was 30 minutes per day. At the end of this study, they demonstrated that there was a 3.5, at the end of 3 years, they demonstrated a 3.5 kilogram loss versus 0.9 kilogram loss, weight loss that is, on average, which was significant at the end of 3 years. I'll come on to what that translates to in a moment, but importantly, it demonstrates that dietary and exercise interventions are capable of creating weight loss. The next study that I want to talk about is the diabetes prevention program, which was a US study, and this was much larger. Over 3,000 patients, 3,300 patients, again published in the New England Journal of Medicine a year later. And what they looked at on this occasion was diet and exercise compared against metformin versus the placebo, which was regarded as usual advice. Again, it was all about the prevention of diabetes in individuals with impaired glucose tolerance and the metabolic syndrome. So these were overweight and obese patients with impaired glucose tolerance. So let's go on and have a look at the results of those studies. This is the Finnish DPS study. This is taken from their New England Journal paper. And what you see here, and I'll try and highlight it a little with my pointer, you can see that if individuals were compliant with one aspect of, and we've got the control group here, and the incidence of diabetes in these patients over a 3-year period was between 30 to 40% incidence over the 3-year period. If these individuals were not compliant with any of the therapies, the dietary interventions and the exercise, then we were looking at about a 30 to 40% rate of developing diabetes in this group with impaired glucose tolerance. But look what happens as individuals become more compliant with the interventions. The rate declines down to something like 5%, indicating that the more individuals are compliant with dietary interventions, the more likely we are to prevent the occurrence of diabetes. And sure enough, this was supported by the US DPP program, Diabetes Prevention Program. And what they demonstrated here is in these individuals, the 3,000 patients, so a much 6 times larger study. They compared placebo versus metformin, 850 milligrams BD, with intensive lifestyle intervention. And this intensive lifestyle intervention included individual nutritional advice, but also a program where they were expected to do 150 minutes of exercise weekly, which is about 30 minutes of exercise 5 times a week. And they were aiming to try and produce a 7% weight loss. So at the end of this program, which lasted about 4 years, 50% had lost the 7% in weight. And they found that about 58% of the individuals were compliant with this exercise program. So that's great. But again, what we see is the weight loss, as you saw in the DPS program, the Finnish DPS program, the 0.1 kilogram weight loss with the usual treatment, so hardly anything at all. Metformin, which was one arm of the study, was associated with a 2.1 kilogram weight loss. And importantly, the intensive lifestyle intervention, and I want to get this across, there was a 5.6 kilogram weight loss. What did this translate into? And This is a slide taken from the DPP study. Now, I want you to focus on this because over the 4-year course of the program, again we see, as in the DPS, of those 500 patients, we see that roughly 40% in the placebo or the usual treatment, and let's make this quite clear, usual treatment, which entails clinic appointments, talking to them about improving their diet and exercise, 40% develop diabetes. Typical and confluent with what we see with the DPS study that had been published a year before. But in those individuals treated with metformin, there was a reduction down to about 30%, about a 10% reduction. But as we got there, 31% reduction, so 10 down to about 29% gives us a roughly 31% reduction in the development of diabetes in those individuals. So we can see that pharmacological therapy can be very effective in reducing or preventing the development of diabetes in those individuals that are most prone to develop that. But look, this is the interesting thing. This yellow line here demonstrates a 58% reduction. So we're down to 20%, slightly less than 20% in comparison to this 40%. 58% reduction in the development of diabetes by intensive lifestyle intervention. And of course, remember, we're looking at about a 5 kilogram weight loss in these individuals. So evidence indicates that the number needed to treat to prevent one case of diabetes with lifestyle intervention is 6.9. That is pretty good when we look at primary prevention studies with regard to statin therapy in preventing heart disease, where you're looking at about 30 patients. This is lifestyle intervention preventing diabetes, about 6.9, 7 people you need to treat with that intensive interventional strategy to prevent it. In contrast with 13.9, 14 people to prevent one case of diabetes if you treat them with metformin. So that's still pretty good for pharmacological intervention and for a drug that is very safe. So let's now look for the last part of the talk. We've spoken about that, and there's also the Dajing study from China that I didn't really talk about as part of this. So that was published in 1997 in Diabetic Medicine, where again they also demonstrated in a South Asian population, in an Asian population, the fact that you could prevent diabetes by interventional strategies, including diet and exercise. And really, diet was equivalent to exercise, which was equivalent to diet and exercise in comparison to the usual treatment in preventing diabetes. Let's now look, and I want to quickly go through this because I want to take the questions next, at what we know in terms of lifestyle interventions for patients with type 2 diabetes. Now, there are a number of studies that have looked at outcomes, including the STENO2 study, Look Ahead Action for Diabetes, and that stands for Action for Health in Diabetes, published in the New England Journal in 2013. I'm going to spend a little bit more time on that, as well as some other smaller studies. And none of these have really demonstrated the efficacy of lifestyle interventions in terms of preventing problems or preventing mortality in individuals with type 2 diabetes. But this meta-analysis that were published in the Annals of Internal Medicine revealed that there's some favourable evidence with regard to lifestyle interventions in terms of weight loss, which clearly is a good thing. HbA1c, again, they regard as low evidence in terms of reducing HbA1c, but one would appreciate that as you reduce weight, you should begin to see a reduction in HbA1c as well, although the evidence is not great for that. But there is a suggestion that lifestyle intervention with pharmacological therapy can be effective in reducing both weight, HbA1c. And of course, with intensive lifestyle intervention, so we begin to see that there are favourable outcomes with regard to what these individuals are eating. So we know that nutritional advice, if it's done properly, can be effective. But I want to look now specifically at the Look Ahead study that was published in the New England Journal, because that's the most recent data. And as we see up in the right corner, this was looking at cardiovascular effects of intensive lifestyle intervention in type 2 diabetes. Over 5,000 subjects, so a big study of type 2 diabetics. And it was a study over a long period of time, 9.6 years, where they intensified that. And it was contrasted with their usual care. Now, bear in mind that the primary outcome, and I know it's the primary outcome, was cardiovascular events basically, and cardiovascular mortality, with a secondary outcome looking at hospitalization due to potential cardiac events. Their aim was to try and get a 10% weight loss, and what they were doing is, if you contrast with the DPP study, they were looking at 175 minutes of exercise per week. Now, it was a bit of a negative study in that it showed no difference in the primary or secondary outcomes. But if you delve into this study, what you do see is that the individuals had a lower blood pressure in comparison to those that were on routine care. They had less, as a consequence, they required less antihypertensives. In terms of lipid parameters, it was pretty much of a muchness, but their HDL concentration was lower. But this is quite an important thing. Diabetes, we assume that when somebody has type 2 diabetes, that they have that, and that's it. But it's not. Individuals can have remission from their type 2 diabetes. So they can go back to either IGT or even normal glycemia. And this has been well demonstrated by studies of bariatric surgery, where it results in about a 99% reversion back to normal from IGT following bariatric surgery. But interesting, a significant rate of diabetes remission, 3.4% versus 7.3% in the usual care. 7.3% for those individuals with intensive lifestyle compared to 3.4% those that had ordinary control. But importantly, diabetic drugs were significantly less. So individuals on 2 or more drugs, 52% in the usual care versus 37% in intensive lifestyle. So they need less therapy to control their hyperglycemia. And of course, that translates into improved health economic benefit. So I want to wrap this up now and leave a little time for some questions. But in conclusion, lifestyle interventions are effective, but they need to be intensive in comparison to what our usual care is in both the prevention and treatment of diabetes in certain some parameters, although mortality is still a little bit of a controversial issue. The outcomes with lifestyle intervention in type 2 therefore remain slightly more obtuse, slightly more unclear. But the important fact is the intensive interventions need to be pushed, and they need to be intensive in terms of diet, exercise, and the psychological support. They need to be delivered in a coherent message, because some people will not talk about calorie restriction. We'll talk about that in a moment, and it needs to be emphasized across the team. And of course, the important thing I think that we take from this is that expecting a type 2 patient to run a marathon whilst another patient can run a marathon is impossible. So tailor the intervention specifically to the needs of the patient, and that doesn't necessarily depend upon a specific person, a doctor. Harness the team that you have, which may be a receptionist trained in sports therapy, so that they can provide evidence. It might be a personal trainer. Utilize those resources that are around you and freely available. to deliver the appropriate advice and motivate the patient. Understand things that motivate the patient. Understand where they are. So, and the costs. Clearly, if we can prevent diabetes and we can improve its treatment and reduce the drugs they're on, it's going to consume less for our healthcare budget. So at that point, I think what we'll do is wrap it up, and we'll go to the questions that I've been presented with. And please feel free to add any questions that you want me to address as part of the webinar. So, while I'm waiting for questions at the moment, what I wanted to try and do is focus upon some questions that have already been sent in. And Dr. Gosal has sent in a question on studies that show lifestyle intervention. Well, I think we've addressed that. Lifestyle and its implications in the pre-diabetic population. I think I've addressed that. And what is the best method to reduce HbA1c? Is it exercise, diet, or lifestyle change? Well, I think probably the two are there. There's no evidence that, if you look at the Dar-Jing study, they compared diet and exercise and usual treatment. So what they demonstrated was that there was no difference between it. I think it really stems down to if you improve your exercise habits, almost the diet comes on top of that as well. And I think it's probably more about the motivation of the patient, which is probably the subject of another webinar. But I'd like you guys to try and look at the aspects of motivational interviewing, how to motivate the patients. Because personally, I think the interview with the patient when they first come along and they've got impaired glucose tolerance or they've got type 2 diabetes is focusing on how they can reduce weight, because I think weight is probably the key result of your lifestyle interventions. So that's the kind of target that you want to try and aim for, and it's aiming for targets that are achievable. So when I see them, it's trying to aim for about a pound weight loss every week, but maybe in 3 months I try and aim for a 2 kilogram or a 4 pound weight loss when I next see them again. And of course, it's understanding where they are in that behavioral change model. So go ahead and try and learn about Prochaska's model of behavioral change. See where they are. If they're in the pre-contemplative phase, give them information that will help them understand what it is about diet and exercise and weight that contributes so much to diabetes. So that was another question that we had with regard to psychological interventions. And I think CBT, motivational interviewing, understanding behavioral change model, and tailor, just like we have on any drugs, tailor everything to your patient specifically, because you'll achieve a lot more from that. So I think without any other specific questions, I'd like to conclude this webinar, and thank you very much for joining in, and we hope you've enjoyed it, and we hope you've enjoyed the all aspects of the foundation course. We look forward to welcoming you on the Diploma MSc program as well, and we'll probably have a webinar next week as well, which we'll talk to you about from Dr. Calhan. Thank you very much indeed.